Good morning and welcome to our live virtual hub today. My name's Thomas and I'm part of the group work programme at Dundee Carers Centre. Today we're going to be hearing from Lyndsey from Social Security Scotland, who'll be telling us about the new child disability payment that has been piloted hopefully soon on Monday the 26th. We will also have an update on the Carers Allowance Supplement payment. Please, if you have any questions, put any comments underneath this video. If we cannot get to them today, we will reply to you individually, so don't worry about that. Obviously, some of these questions can be quite personal to you, so some might be to answer questions on the day, but again, we'll get back to you once we know more information. All links discussed today will be posted in the comment section below and throughout, and will be available on the Carers of Dundee website as well, which is www.carersdundee.org.uk. At this point, I'd like to bring in Lyndsey, who will hopefully got an exciting presentation for us today.
Good morning. Hi there, Tom. Hi, everyone.
So if it's okay with you, Lyndsey, if you'd like to introduce yourself and what your role is.
Hi there. My name is Lyndsey Marissis and I work for Social Security Scotland. The department of the agency that I work in is local delivery, which is to set up to develop a face-to-face service for people. And I cover Dundee and Fife areas, and we have teams in all the 32 areas of Scotland.
Oh, it's very busy then. And I believe today you've got a presentation regarding the new disability benefit for children.
Yes, thank you. Yeah, we have a short presentation which covers the benefits that we deliver at the moment through Social Security Scotland, the ones that are in development, including child disability payment, which is due to go live from Monday the 26th of July in Dundee. And then I'll talk a wee bit about the role that we play in terms of local delivery to give people that face-to-face support to help them apply for our benefits. So if we can move on to the background screen, great, thank you. So ourselves, Social Security Scotland, you'll probably be aware of us in terms of where we are in Dundee City, which is our headquarters, and we are the agency delivering benefits devolved to Scotland. So back in 2016, the Scotland Act was amended, and that was following the independence referendum to devolve some powers to the Scottish Parliament, including some social security powers. So legislation was created in 2018 and created ourselves as an agency. So myself and my colleagues, we are employed by the Scottish Government, but we work for an agency of there, and we will deliver the benefits that are created. So if we move on to the next slide, the benefits that we deliver are primarily for people who are disabled, carers, and some people on low incomes who need help with particular costs. So along with our headquarters, which is in Dundee, we also have an office in Glasgow. Obviously, through the pandemic, everyone has been working at home. We've had a very small number of staff who have been based in the offices for the mailroom to make sure people get letters sent out. But we have been working from home throughout this time. And alongside that, we have been developing a face-to-face and local service. So along with the sort of two staff areas that we will have a presence so people can contact us in any area of Scotland. So we'll move on to the next slide. Along with the legislation that we follow, we also have a charter that's been put in place, and it has been created with people with lived experience of the benefits system and people who want to make sure that our system fits the needs of people in Scotland. It's based on rights. You know, it's a right for people to receive social security, and it's a system that should be developed with people, for people, and with the benefits brought in incrementally. So we've started off with sort of one-off payments, moving into recurring payments, and that's because it's a brand new system and we want to make sure that it's tested and developed so that it still meets everyone's needs. You might have some people through the Carer Centre who have taken part in experience panels. They were put together as the agency was being built to basically gather people's views, opinions, feelings on how they feel about the system as it stands and what they would like to see from a system in Scotland. So you might have people who have taken part in surveys or in focus groups. And again, it was towards creating that charter and creating our approach to make sure that what we are delivering meets what people need. Should also say at this point, the Charter does have high expectations for our service, and you may see on the materials that we have as an agency, dignity, fairness and respect. That was created in conjunction with panel members, and it's what we're working towards and want to ensure, not just for the people that we work with, but our employees and importantly clients and their carers or supporters. So if we move on to the next slide now, the benefits that we currently deliver, as I mentioned there, have been sort of one-off payments, but now we do have a number of payments which are paid to people on a regular basis. I won't go into a lot of detail on this. On this presentation today, it will be available, so if you want to have a look through the slides at any point, you can do so. If we move on to the next slide, which should cover Carers Allowance Supplement. Now, this is an extra payment for Scotland. So it's people who receive Carers Allowance from the Department for Work and Pensions. And Carers Allowance obviously is a slightly lower rate than Job Seekers Allowance. So it was agreed for Scotland that amount should be topped up so that Carers Allowance and Job Seekers Allowance were the same amount. The agreement that we have with the DWP is that as opposed to having the payments made sort of weekly or monthly, they are put together in a payment which is paid every 6 months. And that depends on the carer meeting the criteria on 2 set dates per year. So if someone is entitled to carers allowance on a point in time, it's usually in the April or the October, they will receive this supplement. We get a letter to notify them, and the payment is made automatically into the same account that their carers allowance is paid into. It doesn't affect any other benefits. It doesn't affect the carers allowance rate, and the payments aren't classed as income, so they're not taken into account if being assessed for other benefits. This is a payment to acknowledge the work that carers do and to acknowledge it as a job. So the payments which are made at the moment, in line with inflation, it's £231.40, and that is paid automatically into the client's bank account. So if we move on to the next slide. Best Start Grant is a package of 3 payments. These are for young families, and they are for, as you can see from the different payments, for different stages of life. So from pregnancy up to when a baby's 6 months old, an early learning payment around the time that a child would be starting maybe funded places at nursery, and a school age payment around the time a child starts primary 1. There is a lot more information available about Best Start Grant, including some fact sheets, and I'll be able to pass that on to the hosts of today's hub if people wish to have a bit more detail and maybe also help to apply for these. So on to the next slide, which is also for young families, and it is Best Start Foods. And what was a paper voucher system administered in the UK called Healthy Start is now a new payment card. So it works in a similar way to a bank card and can be used to buy foods, fruit, vegetables, etc., infant formula. And again, it's for families on low income benefits. What I should say for Best Start, whether the grant or foods, it does rely on people having a qualifying benefit from the UK system, whether that's universal credit or other tax credits. Again, there are more information available should you wish. So on to the next slide. The other benefit we do provide is funeral support payment, and that's support to help people meet the cost of a funeral. This cost varies across Scotland because funeral costs and burial, cremation, etc., all vary in the different areas of Scotland. Again, clients may be eligible if they receive a qualifying benefit and they have the nearest relationship to the person who has died. So it won't cover all funeral costs, but it does provide part payment towards it. And again, we have a fact sheet available, and there is more information available on the website. If someone you know could be entitled to this, the payment can be made up to 6 months after the funeral. So if you move on to the next slide, which is Young Carer Grant, it is a payment made every year for young people aged 16 to 18 who spend at least 16 hours a week caring for somebody who receives a qualifying benefit. So it's a benefit to spend as they choose, and clients can apply regardless of whether they're at school, in further education, whether they're in work or out of work. And again, this payment is made to young carers to recognise the work that they do. Obviously, there'll be people who are in touch with Dundee Carer Centre already who are young carers, and they may already be aware of this grant. We do know, though, that there are a lot of young people who do have caring responsibilities, but maybe either don't identify as being a young carer or just say as well, that's my day to day. The Carer Centre obviously do a lot of work with schools and with young people to make sure that they're getting what they're entitled to and getting the support that they need. So this grant helps towards that as well. So the next payment, again, it's a payment for young people, and it's Job Start to help with the cost of starting a new job. The payment is £252 or 404 if the young person has a dependent child, and it's payable on receipt of a job offer if the young person has been out of work and getting a qualifying benefit for 6 or more months. You'll see there that care leavers do have a wider eligibility, so they can be up to the age of 25 and don't need to be receiving a benefit at the point of the job offer. So there are a few sort of easements, if you like, or differences for people in slightly different situations that we can offer through our benefits. So on to the next payment now. I should also add that this is set out as chronological. So, the benefits that we delivered first towards most recently. So that's why it does jump around from a young person to a child to an older person. So this other automatic payment, which was brought in last winter, is child winter heating assistance. So if a child receives the highest care component of DLA child, they get £200 to help heat their homes. And for the annual payment that's made, as an example, last year the payments were sort of processed from the 27th of November and completed by the 11th of December. So we did receive all of the information on these eligible children from the DWP to allow us to pay that. So on to the next slide. And quickly, just on the Scottish Child Payment, which is a recurring payment, and it was brought in full. No, it wasn't part of the range of benefits that we had initially had agreed through legislation. But because of levels of child poverty across Scotland that were noted, the need for an income supplement became very apparent. So at the moment, families who receive certain benefits and have a child under 6 receive the equivalent of £10 per week per child every 4 weeks. And then the payment was made, you probably did see it on the news or in the paper. We were encouraging people to come forward from November ahead of the payment being introduced in February 2021, and that was for the sheer volume of people who would be entitled. Obviously, the pandemic brought a lot of people new to the benefit system who are now entitled to things like universal credit when they weren't before. So when you did see information coming out all through the winter, it was to make sure that people were applying and then they could be receiving it as soon as possible from when the payment became live on 15th of February. So on to the next one, the next slide. and the benefits we will deliver in the future, and I should say very near future, the first of which is child disability payment. Now, as Tom mentioned in the introduction, that will be introduced in Dundee from Monday, the 26th of July, for new claims, so people who aren't already receiving child DLA. Dundee is one of 3 areas which is piloting the payment ahead of it being introduced across Scotland from November onwards. So for people who are new to claiming disability assistance for their child, we will be encouraging them to apply to us from Monday. Anyone who does receive DLA child at the moment will have a process whereby the DWP will inform them that they will be transferring over to Social Security Scotland. So they will receive details in advance, and it shouldn't actually cause them any additional work. I mentioned about the experience panels earlier, and some of the feedback that was gathered was around how do we make sure that parents and carers get the information that they need but aren't bombarded with information. The information they get is very clear and transparent, and importantly doesn't cause stress around whether a payment will stop or what it means to transfer over. There will be a process that the information is shared between the UK and Scottish systems, and people's cases will be transferred over in a phased way to make sure that they get the payment that they need. So child disability payment will be coming in from next Monday. And I'll talk a wee bit more about the ways that people can apply in a wee second when I cover the role that I have within Dundee. Into the future, well, into 2022 onwards, adult disability payment will be brought in to replace personal independence payment for people of working age. So, like the child disability payment, and as I mentioned before, around making sure that our system develops in a way that meets the needs of people, it will be open for new claims, and there will be a process whereby people who get PIP at the moment will be moved over to our Scottish system. Likewise, pension age disability payment will eventually replace attendance allowance. There will also be additional payments, as you'll see there, from carers, winter heating assistance for older people, and eventually we will have carers assistance for Scotland as opposed to carers allowance. Scottish Child Payment will also be introduced for children over 6 in a household up to the age of 16. So we do have a lot of benefits which are still in development, and we maybe don't have a lot of information that we can provide at the moment around how they'll be delivered. But just to say that we will be moving to administer that disability assistance, and that means that we have been working very hard on making it a payment that is easy and sort of a compassionate and understanding way for people to apply for the support that we have. Taking into consideration, of course, it's people's right, and we're encouraging people to apply for these benefits and receive them so they get what they're entitled to. So on to the next slide there. At the moment, people can apply for existing benefits on mygov.scot, and it's, again, the application forms have been designed and tested and are continuously improved to make sure that they're easy to understand and easy to follow. Obviously, not everyone has access to get online, or they might find it quite difficult, particularly if they're on, if they're using a small screen, for example, on a phone. So people can apply by our free phone helpline, or they can request a copy by post and return it to our PO box. As I noted earlier on, we have had people working in our offices throughout the pandemic to make sure that people receive postal correspondence. So on to the next slide. I'm not going to go into the massive range of stats which are sitting here, but to give you a flavour of Carers Allowance Supplement and what's been paid in Dundee. In December there were 2,735 payments made December 2020, that totaled 629,000. A payment was made in June to people entitled to carers allowance, so we will have information on that later on in the year. So been around £2 million paid out already for Best Start. And on to the next slide, I'll just pick out the Young Carer Grant in particular, that in Dundee, since its introduction, 125 clients received payments of around sort of £36,000. But as we mentioned there will be a lot of young people who are entitled, so the ongoing work is to make sure that they're identified and they feel comfortable applying, and they are helped to do so if they need it, to make sure that they're receiving this grant. So we move on to the next slide. And the work on local delivery. People can apply online or by phone, but face-to-face contact is a big thing. Sometimes there's no substitute for having that contact with someone. And over the last sort of 18 months or so, it's been it's been a large challenge for so many places to have that contact with people, and a lot of things have been adapted. So including this means of making sure that we get information out to people, and clients may have already used things like Near Me or had telephone contact with workers because they haven't been able to see them in person. Either that, or they have been able to, but it's been in a garden or at a place where it could be 2 meters distance. Face-to-face is the area that I work in, and for child disability payments starting from this Monday in Dundee, we'll also be having that face-to-face service available. We have had to do a lot of additional work, as other agencies have, to make sure that face-to-face is safe and is in line with current restrictions. But we also know that people sort of can fall into two camps. There are people who are desperate now to be out and seeing people face to face, but rightly so, there are people who have a lot of worry, anxiety about being person to person, or the health conditions, would rather do things virtually. So choice has always been very important to us, in fact essential to our service. So face-to-face claim support to us means having outreach available, so being in local centres where we can meet people. It involves home visiting, but it also involves being able to have contact by video chat or by helping people over the phone. So along with the helpline that we have already to help people over the phone, we can do sort of outbound calls now, which our staff would be able to have sort of a long appointment booked in with someone so that they can help them go through. So it might be that someone needs help from the start to finish to complete an application form. It may be that they've started using the online application form but would like our help to answer some of the questions. Obviously, for disability payments, we do need to ask about a person's circumstances and how they are day to day. So it might be that they just need someone's help to get that information down. Our teams also help getting documents and ID verified to help an application get processed. To give any advice and support for a client while their application is sort of in progress. So it might be that when a form is submitted, we have to gather supporting information from the services that a person is working with, including medical professionals. So to give a client that help as that is being done. And we can offer help for people who wish to challenge a decision that's been made around their benefit. So it may be that they've been declined, or they have maybe received a lower component than they thought. while we do have an independent department which deals with redeterminations, so want to challenge that decision, or if they're not happy with that resolution, to then go through the appeal process or to make a complaint. An independent part of the business does do that for them, but our staff will be able to help them say, right, this is what to expect next. These are the sorts of things that you'll be asked to provide. And we can give that type of assistance while recognising that a client should have the opportunity to have that considered separately. So on to the next slide, which I think is the last slide. And I mentioned there about having that face-to-face contact. While we want to have that real, personal contact in services and visiting places out and about, we do know that it might not be fully possible at the moment. So in line with some other services, we can offer appointments. So at the moment, we don't have the facility to enable somebody to just drop in, but then a lot of buildings don't allow that either. We have to be restricted on the numbers and the access for people for safety. So we have appointments that people can make by calling our helpline. They get put through to our appointment team and they'll be able to establish where they stay, what type of appointment they're looking for, and offer them options as to where to go. So a lot of services in Dundee already either have that telephony-based appointment, or they can be, say, a Wednesday afternoon at a community centre or a Monday morning somewhere. So we will work in the same way that someone can choose to visit a centre which is 2 minutes down the road, or if they want to be in the city centre because they're going there anyway, or it's best use of their bus fare, then we can offer those options as well. And eventually we will be building on the number of places that we offer our service as all of our benefits are brought in. So along with home visiting, which again we're not quite sure how people feel about us visiting them in their homes, and rightly so. It has been a tough year and a bit. The home visiting is available if that's what the client wishes. We are also developing processes for getting to prison and to hospitals so that people receive the support by the time that they're coming back out into the community. But again, with the pandemic, there are very important considerations to be made. And again, we're not going to be wanting to physically go into hospitals when there's safety concerns that are in place. But I mentioned there that there is a facility to have video chats. We use the Near Me service. Our staff have been trained on that in the last week or so, and a telephone system as well that people can have. So essentially that's where we're at, and those are the benefits that we offer just now and the ones that are coming on in the next wee while. So I'll open you up now. Well, firstly saying thank you very much for listening. And again, I'm very relieved I haven't had my small children coming in to interrupt me today. So if anyone has any questions, if you'd just like to type them in, or able to field them, and I'll answer them best I can.
I'd also like to mention, if you were interested in hearing reading more about those stats that you mentioned earlier in the presentation, once this video is saved on our Facebook page, you can go back and pause it so you can read them as well, if that's easier for you, because it's quite interesting, actually. Mm-hmm. I have a question, actually, because I'm quite interested. Is there a big difference between DLA then and the new child disability payment? Like, what are the major differences, do you know?
The major differences in the way that people can get in touch to apply, and the way that the information is processed to make a decision. The criteria and the payments don't really change. I think if there are going to be changes made, those would have to be kind of put in legislation and sort of agreed. But the big difference is offering the choice to people on how to apply, how information is gathered, and the support that's available for someone as things are processed. For child disability payment, we don't have what we would call consultations. For PIP, obviously, people are used to an assessment process where the way that our system is developed is that information is to be gathered to help a person's application, and it's only if we can't get that evidence from all the different sources that's when we would have a consultation again, just to help get that evidence from someone. But the idea is that there's going to be far fewer assessments. And importantly as well, that if someone is getting child DLA at the moment or PIP, they won't be reassessed because they're coming over to us. That's not a condition of moving over. They will be moved over on what they receive.
So really, it seems like they're taking more into account of your own professionals and people that know you better, as well as doing the assessment thing. That's good. Oh, really interesting.
Yeah. And in terms of the way that the application is, people can apply online, or they could have our support, but the forms have been designed to avoid repetition and asking for unnecessary information. So as you'll know, an application could take a while, and it could be quite a hard process for somebody to kind of have to sit and think of everything around their situation and how the day-to-day impacts are. It's hard enough doing that without sort of feeling that they're having to sort of reiterate a lot of things. So the form is created to help remove bits of duplication and for our staff to be trained in gathering that information at the very first point and asking the right things, so that they're not sort of having to come back and rehash what they've already submitted.
And when you mentioned previously as well about if they come to you, you can do the ID stuff there and then, which also be nice and easier. If you're doing it yourself, then do you have to like send pictures and stuff like that, I'm assuming?
Yeah, you're able to get ID verified. There are, obviously with this being a pilot, there are some things that we're still developing what will be the long-term technical solution to having things submitted. So it may be that for the first wee while, people do need to present us with the identification as opposed to being ways of uploading it. But that there are a lot of things in development to help cut that down in the longer term.
Brilliant. Okay. Well, it seems like I can't see any questions popping up. Maybe we've got one here coming.
The claimant have to pay for additional evidence, or does Social Security Scotland cover these costs, such as GP reports? Thanks, Carol. I understand the claimant doesn't have to pay for that additional evidence. However, I'm just going to double check that for you. Obviously, there are a lot of different avenues that people can get additional evidence from. So I wouldn't want to sort of have that blanket comment. So I'll come back and confirm that, and I'll put it into the comments that are following from this hub, and I could also send it by email.
Brilliant. Oh, there's another one.
For carers that get carers allowance, if there's a new allowance for carers, will these be taxable, as some carers lose money from UC and income support for receiving carers, especially on old legacy benefits? So at the moment, we only provide that supplement for carers that get carers allowance. I know that in some circumstances, people will move to be on universal credit, and that's got a slightly different element. So our allowance and the supplement that we provide is only based on that entitlement to carers allowance. When it comes to the updated carers assistance and the stage of development that's at, I couldn't provide a comment at this point in time, but there will be sort of further updates as that benefit is sort of developed, and when the regulations for it are laid in Parliament, that's when that information will become clearer.
So really, at the moment, the carers allowance and the carer supplement are sort of separate, but then once it all goes into the one future payment thing. That'll be things might change, but obviously don't know at the moment.
Yeah.
Okay, any other questions? I can see. I would say your presentation was very good, because every time I thought I had a question, the next slide answered it, so it was quite good actually.
Oh, I'm glad that was a stroke of luck. So.
Well, it looks like that's it then. Yep, no more questions. But as I said, though, if you watch this over in the future and have any questions, feel free to put a comment, put it in the comments section, and we'll get back to you. And thank you everyone who's joined us today. This episode will be available on our Facebook page and on our virtual hub gallery on our own website, where you can also see a list and links to all of our past episodes. And obviously, thank you, Lyndsey, for coming today. It's been really interesting. Any questions? Yep.
Yeah, no, that's great. Well, thank you very much for your time this morning. We've been in touch with the Carers Centre and its various groups over the last sort of nearly 2 to 3 years now, and we'll continue to be in touch. So if you do have a query, or you think you would maybe like to raise it from one of the other groups that you're involved in, then the staff will be able to pass it on to me, and we'll be able to get an answer for you.
Yeah. Thank you very much. Yeah. And we will have another virtual hub in August. We will confirm the topics through our social media channels. So thank you everyone for listening. And again, thank you, Lyndsey. It's been really interesting today, and I'll see you all later.
That's great. Thank you very much for your time. Thank you. Bye.